Hello, my name is Mary Kellner. I'm the Benefit Administrator for here at Valley View School District. I'm going to review with you your benefits presentation for your insurance coverage options. We're going to offer a health, vision, and dental benefits. The benefit information, all full-time employees who are eligible and or enrolled under the Employee Health, Vision, Dental plans are provided with access to the VVSD website. This website contains all plan information and forms under the Insurance Department tab. Your ID cards will come from BlueCross BlueShield. You'll end up with 3 total, 1 for medical, 1 for dental, and 1 for vision. We'll start with the dental insurance. The dental plans offered through BlueCross BlueShield. It is a PPO plan. It has a $25 per person deductible up to a $75 deductible per family and a maximum benefit of $2,000 per person per calendar year. The dental schedule of benefits for preventative and diagnostic are covered at 100% of the eligible expenses twice a year. Restorative, endodontic, periodontic, and oral surgical services are covered at 85% of the eligible expenses after the calendar year deductible is satisfied. Lastly, crowns, inlays, onlays, and prosthodontic services are covered at 50% of the eligible expenses also after the calendar year deductible is satisfied. Premiums for the dental insurance are as follows. Single coverage is $2.71 per pay. Employee plus one, if only you have one dependent that exists in the household, is $10.42 per pay. And family, which is 3 or more, is $20.83 per pay. As you can see, this does go across your full 24 pays of the year. For the health insurance, it is a BlueCross BlueShield plan. It is a PPO. We're also going to review the prescription drugs, the vision plan that is bundled with your health insurance, and flexible spending accounts. Valley View School District is a self-funded plan, which means that the district pays all the claims. Although you will receive a BlueCross and BlueShield ID card, the insurance plan is actually the school district's. The plan is created by the administrators and the teachers union. Pre-tax medical dental premium payments. Upon enrollment, you have the opportunity to take advantage of current laws and regulations to save taxes on the following. Your premium payments for group medical and dental coverage. And what this is you can set aside and have your premiums for your insurance taken out on a pre-tax basis prior to applying any federal or state taxes, which ends up bringing down your gross taxable income. The Preferred Provider Organization Network, the PPO, our claims administrator, BlueCross and BlueShield, has access to their PPO network. It is the largest network that BlueCross BlueShield offers. Although most providers would be in this option, you are definitely recommended to go online and double check for your providers to make sure they are in network. Inpatient hospital and outpatient. Hospital benefits are $250 copay for an emergency room visit. That visit copay is waived if you are admitted directly from the ER into the hospital. For in-network PPO hospital coverage, it is 90% outpatient and inpatient, and out-of-network is 60% coverage outpatient and inpatient. You can find network providers by going online to the BlueCross BlueShield website as indicated here at bcbsil.com and click on Find a Doctor or Hospital, and then you would select the PPO, the Preferred Provider Organization Network, to locate the provider near you. Diagnostic outpatient X-ray and lab. In-network outpatient diagnostic services, X-rays and labs are covered at 90%, of course subject to the deductible, and out-of-network outpatient diagnostic services, X-rays and labs are subject to 60% coverage subject to the deductible. Urgent care facility visits. Urgent care is covered at 90% subject to your deductible, and then out-of-network is 60%. There are no co-pays. This is once you satisfy your deductible, then it will begin to pay the plan benefits. Annual maximums. Certain services under our plan have benefit visit maximums. If there are any, they will be listed here. Also on your summary of benefits and coverage in the insurance packet that you received from HR. For chiropractic visits, you get 30 visits maximum per calendar year. Physical therapy is 110 visits, occupational 28, and speech is 19. Again, this is on a calendar year basis, so that way it will reset every January 1st. Physician benefits. All office visits have a $30 copay, whether they are specialists or your regular care physician. Also, things to know is our out-of-pocket maximum. For an individual, it is a $1,500 out-of-pocket maximum, and family is $3,000. This does not include any excluded charges, such as any benefits incurred in excess of the maximum benefit, charges incurred for services or supplies covered under the dental care portion of the plan. Wellness and preventative care. Our plan covers in-network preventative care for eligible adults and children at 100% with no deductible. We also offer at one time a year a wellness exam here at the district at various locations. If you are enrolled under the benefit plan, this is provided at no cost to you. The birthday rule. The benefits of our plan follow the birthday rule if you decide to double cover a dependent. So what that means is if one parent has coverage for the family and the other parent has coverage for the family, the parent whose birthday falls earlier in the calendar year, not by birth year, will be the primary payer of the benefits. So if one parent is March 25th and the other parent is July 6th, the parent whose birthday is March 25th will be the primary payer for the benefits for the dependent children covered. Our plan has a working spouse eligibility provision for AFT and administration. What this means is if your spouse is eligible for group health insurance through his or her employer, they would not be eligible to participate in the VVSD health, vision, or prescription drug plan. If your spouse is not eligible to enroll under employer group health plan, then they may be able to enroll underneath the district's health, vision, and prescription drug plan, providing the employee has submitted all the necessary documentation, which includes an affidavit, an inquiry form, and additional documentation as required on the affidavit. Prescriptions. Mail order is mandatory for maintenance medications underneath our plan. What that means is if you are taking something on a regular basis, not just a one-off here or there, but on a monthly basis, you'll be able to fill your prescriptions at the retail pharmacy for the first 3 fills, and upon that 4th refill, you will be forced to go to mail order and complete the paperwork. All the forms for that are listed on the VVSD website as well, and if you have questions, you also can contact me and I can send that form over. Once you complete that form and send it off to your provider to complete and send in, you create online access, and then you will now receive 3 months worth of prescriptions directly to your door without shipping charge for a 2-month copay price. Prescription drugs. If you and your dependent children are on the district's coverage, if they are primary with us, they'll be able to utilize our prescription drug program. If they are not primary underneath us and they are secondary due to that birthday rule, then they are not eligible to participate in the prescription drug plan. The prescription drug costs. At a retail pharmacy, as you will see, all generics are $0. That means they are free. Our formulary are $40 copays, non-formulary are $60. For our mail order, again, generics are free. Formulary is $80 and non-formulary is $120. Now we'll review the vision plan. It is through BlueCross BlueShield. It is a free benefit provided to you at no cost. The only way you can obtain the vision coverage is you must be enrolled in the medical in order to get the vision coverage. The enrollment in the medical is mirrored that on the vision. The vision benefit plan summary. This is just a rundown of the benefits. There is a much more detailed benefit summary in the packet provided to you by HR, but the basics you need to know is for an eye exam every 12 months you qualify for. It is a $10 copay. You can get prescription drug lenses also every 12 months with options there, single, bifocal, trifocal at $25 copay. Frames you can get every 24 months with a $130 allowance with a 20% discount over and above the $130. You can also get contacts in lieu of eyeglasses every 12 months, and those also have a $130 allowance. Premiums for the health insurance are across 24 pays, just like the dental coverage. So for single coverage, it is $65.33 per pay, and for family, which in this case is 2 or more people, is $181.50 per pay. Next, we'll review the life insurance and long-term disability. This is provided at no cost to you, and it is provided by BlueCross and BlueShield. In order to receive this benefit, all you'll need to do is complete your beneficiary form, make sure you sign it and date it, and indicate who you want as your primary beneficiary. There is a secondary beneficiary section listed. Please be sure if you list any secondary beneficiaries there as well. And if you do not want a secondary, that is okay, but you must have a primary listed. Flexible spending accounts. Flexible spending accounts, or FSAs, let you set aside part of your pre-tax pay for use for out-of-pocket medical expenses like co-pays, deductibles, or dependent daycare expenses. The money you put into the account is deducted from your paycheck before federal and most state taxes are taken out. And you don't pay taxes on the money when you use it to pay for medical expenses. You can enroll in one or both accounts even if you're not on our medical plan, and we offer both the healthcare FSA and the dependent care FSA. Important things to know about our flexible spending plan. It runs on a calendar year basis from January 1st through December 31st, and enrollment is only available during open enrollment every year. Open enrollment here at the district is December 1st through December 14th for a January 1st effective date. Information in regards to how it works is also posted on the VVSD website and through this link listed here for Health Hub. We are administered by PayFlex. It does follow a use it or lose it rule, meaning if you do not use all of your dollars that you set aside in that plan year, you will forfeit that money. So for example, if you don't use all the money in your healthcare FSA by the end of the plan year, any balance over $500 will be forfeit. So be sure to set aside only what you think you'll need for eligible expenses. Dependent care accounts do not have a rollover option. Only the FSA allows you to roll over up to $500 of unused funds to the next plan year. You can't transfer money between the two accounts, so what money you have in the FSA has to be used for FSA expenses, and that you have in the dependent daycare has to be used for dependent daycare. You can't change your elections during the plan year either, except within qualified changes in status, such as marriage, divorce, or birth of a child. If this occurs, you have 31 days in which to notify the insurance department. Healthcare FSA, the money you contribute to a healthcare flexible spending account can be used for out-of-pocket expenses for yourself and your eligible dependents. These expense examples are such as medical, dental, and vision plan deductibles and copays, office visits and outpatient expenses not paid by your plan, prescription drugs, and some over-the-counter drugs used to treat illness or injury if prescribed by your doctor, which this has a $2,750 maximum contribution. So you can set aside up to $2,750 every plan year. The dependent care account, this money you can use to set aside to care for qualified dependents, such as dependents under the age of 13, dependents who are disabled, elderly parents if you provide more than half your parents' maintenance costs during the year. This you are allowed to set aside up to $5,000 annually or $2,500 if married and filing separately. Expenses for the care are only qualified for the dependent if they are eligible, if the care enables you to work. Open enrollment. Open enrollment is your annual opportunity to review your benefit choices and make any changes if necessary every year. It is also the only time you are able to participate and elect the flexible spending account. Open enrollment is, again, December 1st through December 14th every year for a January 1st effective date. Things to consider: certain dental procedures have waiting periods before you are eligible for benefits. Refer to your employee dental plan booklet to find out what these are if you're having some major work done. You cannot change your medical or dental enrollments or the money you elect to have a pre-tax for an FSA until the next plan year unless you have a major life event change, and you must submit that within 31 days. So for example, some of these life events are marriage, divorce, birth of a child, a job loss with job coverage loss. Things like this occur throughout the year outside of open enrollment. You will want to contact the insurance department within 31 days of that loss of coverage or that life event in order to make changes to your elections. If it is outside the 31 days, coverage changes are not allowed. More things to consider: the health and dental plans use the birthday rule to determine eligibility for dependent children. Again, what that means is only dependents who are primary under the district's medical plan will be included as dependents for the prescription drug card program. Should you have any questions or concerns outside of this presentation, please feel free to give me a call at 815-886-2700, extension 6015, or feel free to send me an email. My email is also listed on the VVSD website under the insurance section, but it's also Kellner, KELNERME @vvsd.org.